My name is Carolyn Hullick. I'm an emergency physician, and I have a really strong interest in how we can better care for acutely unwell people who come to our emergency departments. I think when you're coming to the emergency department, it often happens in an emergency and acutely, and you're not really planning to go. So it's actually really helpful to think about the things that you might need when you come to hospital, and even maybe having them organised so that you know when the ambulance arrives, they can help find those things for you. So I think the things we need are your medicines, and ideally the ambulance will actually want to bring the medicines that you have, but having a list that's up to date, which says what time you take them, why you're taking them, is really helpful for us in the emergency department as well. I think people with dementia often have quite a few different aids that are really helpful for their care, and actually bringing them to hospital is really good. So things like glasses, hearing aids, walking frames, walking sticks, continence pads are all things that that will make you more comfortable in the emergency department. But there are also things that will make it less likely for you to get delirium when you're in hospital. Another thing is the top 5 strategies. So for us to be able to best care for people with dementia, we really need to understand them and understand their priorities, but also things like what are the things that makes the person get agitated, what are the things that makes them comfortable and calm, what are the kind of strategies that maybe a carer would use in order to support that person. If you can think about those things, that makes it much easier for us to provide good care in the emergency department. Advanced care planning is something that's really important for people with dementia. It's actually really important at the beginning when you're first diagnosed with dementia to think about those plans, particularly when it may be that as your dementia is advancing that you might not be able to express those, what's important to you and what matters to you. So I think having an enduring guardian, knowing who the person is who can make decisions on your behalf, but also knowing the person that's actually going to make decisions for you that will respect your wishes and what matters to you. So the ED is a chaotic, crazy environment, and for people with dementia, that can be quite a confronting thing. It's there's ambulances and trolleys and people everywhere and bright lights and lots of movement. And if you think about someone with dementia coming into that environment, it can actually be quite confusing and difficult for them. They're at risk of things like falling over and injuring themselves, and it's actually not uncommon for people who come and are admitted to hospital to get delirium, based in some ways on the environment that we have. Delirium is an important thing to think about. So for people with dementia, the more cognitive impairment you have, the less reserves you have and the more likely you are to get delirium in hospital. And delirium is a pretty confronting condition where people become confused, they may become agitated, they may actually have hallucinations, and it's really confronting for the family to see the person they love behaving in that manner. I think there's lots of information about delirium in the hospital that's available, and you should think about it and read about it. It's important to know that delirium's reversible and that the person will get better. Often in the ED, people can be critically unwell, and sometimes they're not, but we also need to think about what might happen if their condition deteriorated over the next few days. So in some ways in the ED, it's a good time for families and the person to talk through what they expect over the next few days in the hospital. I think if you're a carer and you're being asked to make decisions on behalf of someone else, I think it's really important to just think through what it is that person would want if they were able to make the decisions for themselves, because you're making the decision for that person and their best interest, not your own. The other important thing to think about is carers, and I think if you're someone who's looking after someone with dementia, it's really exhausting, and often by the time you've got to the ED, you may not have actually looked after yourself for the last few days because you've been so busy looking after that, the person that you love. So I think it's important to ask for help. It's important to let people know that you are exhausted, and it's okay not to be there if you need to have a break yourself. I see a lot of older people in the ED, and they're reluctant to ask for help, and they're reluctant to, particularly if the person's going home, they're very keen on their privacy and their independence, and they think that by doing everything themselves that that they're going to have a better outcome. People are often terrified about being admitted to an aged care facility, but the reality is, I think that there are a lot of packages and programs out there that will help you as a carer and as a person with dementia, and that if you actually use them and take them, it will actually allow you to stay at home and live independently for longer. We often spend a lot of time planning for going to hospital, but I also think we need to think about what needs to be in place for going home from hospital. I think two things to think about. I think that people with significant dementia are often much better going home because they're going to be less confused, less agitated in their own environment. But in order to do that safely, you as a carer may actually need a whole lot of supports. And as I said earlier, it's really important that you actually ask for help when you need it. But the things to think about are, when you're going home, have you got an appointment to see your GP? Have you let the GP know that you've been in hospital? Making sure that you've got the discharge letter with you when you go home, and if you haven't, asking for it. I think thinking again about your medicines. Often when you've come to hospital, the medicines have changed, and the doses have changed, and the drugs you take, some things have stopped, some things have started. So having a really clear list of your medicines is really important. In our emergency department, for older people, who, particularly those with complex needs, we will do follow-up phone calls. So it might be that you can find out if the aged care nurse will be calling tomorrow, and they'll be asking you things like, how have you gone? Have you made these appointments? Do you understand what we're covering in the ED? So I think a follow-up phone call is a really good thing that we do. I think if you've got an aged care provider who's supporting you at home, it's actually good to let them know that you've been in hospital too. It may be that you can actually get extra support through your aged care provider when you've gone home. But we also can access things like some of the Commonwealth packages to give you extra support at home if you don't actually have an aged care package in place. So those packages are actually available for people who have been to the ED and can provide care for up to 6 weeks after you've gone home. And they're things like cooking and cleaning and getting to appointment, transport, gardening, a whole lot of things that you need, showering, that in order to be safe at home.